Back in 2009, the boards of NHS Blackpool and Blackpool Hospitals NHS Foundation Trust took part in a two-day learning event to facilitate an understanding of their role in leading safe, high-quality services. The Boards on Board programme provided a key opportunity for the trusts to build joint QIP strategies and has led to significant improvements across the entire patient journey.
We took part in the Boards on Board programme because I think we really wanted to raise the profile of safety in the organisation, and we wanted us all collectively as well as individually to understand our responsibility as board members for safety. I think what we were hoping to achieve was to improve our safety record and to learn about how we might go about doing that and really put patient safety and quality at the heart of our business.
Good. The treatment, everybody's been nice.
When we were first offered the opportunity to take part in the Board on Board programme, we thought, well, it would be a good opportunity to take some time out to work more closely with the board at the Acute Trust and to develop some of our working arrangements. What we didn't realise until we went through the programme is perhaps how lacking in focus on quality of services and patient experience that we had been, and the programme was an ideal opportunity for us to refocus on that and ensure that we did take that into account when we're commissioning.
From going on the Board on Board programme, we recognise that we ought to develop further examples of patient experience, look at some of the issues that have arisen from patients, look at complaints in more detail to say what are the quality issues facing patients. So we did bring much more live examples to the board and did start to bring in many more quality metrics.
Prior to attendance on the programme, it's not that we didn't concentrate on quality and safety, but I think there's an awful lot of noise, isn't there? An awful lot of white noise around, and particularly in the business of the board, an awful lot to do. I think the attendance on the Boards on Board programme gets you to really rethink your entire approach in truth, and they keep coming up with this phrase about bringing the patient into the room, and I think that was the thing that was probably absent before that's been very, very present ever since.
Well, originally we wanted to carry on building the relationships we had with the Hospitals Trust and ourselves, and get the board members working closer together. So that was the original reason for going on the programme. As we got more information about it, it became apparent that it was very focused on the quality issues, and we decided at that point to use it very much to work on some of the quality issues that were facing both organisations as commissioner and a provider of services.
The key elements of the Boards on Board programme, it's a very comprehensive programme, but it gets you thinking initially about health as a safety business. And it compares us very, very unfavourably with virtually every other business out there, and makes the point that if we were any other sort of business, actually, we would be shut down. We harm too many people and we nearly harm an awful lot more. So that was really, really powerful learning. When one starts looking at it like that and thinking about avoidable harm, it really can lead to quite a powerful change in mindset about, well, all right, then these problems that people regard as being intractable, perhaps they're not intractable, perhaps we can do significant things.
It must have been a hell of a shock.
That's my husband.
You start to begin to think behind the numbers and stats that can be quite bland out, this sort of stuff, and think about very, very powerful human stories about their experience in healthcare.
NHS Blackpool and Blackpool Hospitals, we have excellent relationships and always have had. But I think that the thing we found from the programme, both of us, both organisations, was it really helped us to focus on the quality side of the agenda, really recognise that we can improve and we can do better.
I think this programme is very important in helping to improve and develop the relationship between the PCT at board level and the Acute Trust. We had quite a good working relationship before, but I think the opportunity to sit down and focus together on some very important aspects that aren't always a top priority has really helped develop that relationship.
I think in the current climate there's obviously a risk that people will row back on spending on leadership development. My own view is that would be a big mistake, you know, and actually doing a programme like this, doing it together, is as excellent value for money. The payback is way above what one would ever spend on it, both for yourselves as individuals, but more importantly for your organisations.
I think the Board on Board programme has been an extremely worthwhile investment, both in terms of resources and time. It's not always easy to get senior people in an organisation to sit down together. I think taking that away from the office and giving you a couple of days to focus just on those important aspects together with no other distractions.
This Boards on Board programme has been an incredibly worthwhile investment. I can't think of a programme actually where we've attended or colleagues have done and come back and implemented so many things as a result of being on the programme, and that's the reason I would particularly recommend it.